Have you ever lost your erection right in the moment of intimacy? Or maybe you start strong, but it feels like a switch suddenly flips off in the middle of the act, leaving you frustrated and confused? Or perhaps you can't even get things started in the first place. If this sounds familiar, take a deep breath. You are not alone. This is an incredibly common issue that men face, but many suffer in silence, too embarrassed to speak up, often pulling away from relationships or giving up on their sex lives entirely. But you don't have to accept this as your new normal. Today, I'm going to walk you through 3 practical, sustainable steps to help you regain a strong erection and maintain penile rigidity during intercourse. We're going to look at how to achieve this without relying on medication, or if you are already taking something, how to make those treatments work significantly better. And we're going to do this without any miracle cures or internet gimmicks, just science and physiology. Let's get straight to the root of the issue. To fix the problem, you first need to understand how the machine works. While an erection involves your hormones, your nervous system, and your psychology, it is, above all else, a vascular phenomenon. It is about blood flow. When you are sexually stimulated, your body releases specific substances to open up your blood vessels. The most important of these is a molecule called nitric oxide. Nitric oxide is a potent vasodilator. It signals the arteries in your penis, specifically the cavernous arteries, to relax and expand. This allows a rush of blood to flow into the corpora cavernosa, the sponge-like chambers inside the penis. As these chambers fill up, the penis becomes rigid. But here is the crucial part for maintaining that erection. As those arteries expand with blood, they need to press against the veins that normally drain blood out of the penis. By compressing these veins, the blood is trapped inside. This is what keeps you hard. If that trapping mechanism fails, the blood leaks back out, and you lose the erection. This is what we call venous leak. So, fundamentally, we need to improve your vascular health to ensure that blood flows in strong enough to trap itself there. The medications you might know, like sildenafil or tadalafil, work by helping this dilation process. But today, we are going to focus on how to trigger this biology naturally. This brings us to step number 1, the hardware. We need to focus on physical activity and specifically, the gymnastics of the pelvic floor. You might not think of your penis as something you can take to the gym, but the muscles supporting it absolutely need training. General exercise is great because it improves overall circulation, but we need to target the pelvic floor muscles. These are the muscles that actively help sustain rigidity and prevent that blood from escaping. The most effective way to train this is through Kegel exercises. However, many men do them incorrectly. First, you need to identify the right muscle. The easiest way to find it is to try to stop your stream of urine midflow when you go to the bathroom. That muscle you squeeze to cut off the flow? That is your pelvic floor muscle. Now, a very important warning. Do not use the stopping urine method as the exercise itself. That is just to locate the muscle. Doing it repeatedly while urinating can actually cause bladder issues. Once you've found the muscle, you can do the exercise anywhere, sitting in your car, at your desk, or watching TV. Here is a basic protocol to start with. Contract that muscle for 3 to 5 seconds, then relax for 5 seconds. Do this for 10 repetitions. Repeat this cycle for 3 sets a day. Consistency is everything here. Over time, you want to progress. Aim to hold that contraction for 8 to 10 seconds. If you do this consistently over the course of 3 months, you will likely see a substantial improvement in the strength of your erection and your ability to control it. If you find it difficult to locate these muscles, or you aren't sure if you're doing it right, don't hesitate to see a physiotherapist who specializes in the pelvic floor. They can guide you. Additionally, exercises like squats and leg lifts are fantastic for driving blood flow to the pelvic region, and some men benefit from vacuum therapy, using a penis pump as a form of gym for the cavernous bodies to stimulate oxygenation and elasticity. Now, let's move to step number 2, the fuel. We need to look at your nutrition. If an erection runs on nitric oxide, we need to feed your body the raw materials to produce it. You want to incorporate foods that are natural vasodilators. One of the absolute best foods for this is watermelon. Watermelon is rich in citrulline and L-arginine. These are amino acids that your body converts directly into nitric oxide. Interestingly, the highest concentration of these nutrients is found in the white part of the rind, right between the red fruit and the green skin. Another powerhouse is the beet. Beets are incredibly rich in nitrates, which also boost that vasodilation pathway. Then you have lemons, which are full of vitamin C and antioxidants that protect your blood vessels and reduce inflammation. Cucumbers and dark leafy greens are also excellent additions to this pro-erection diet. But none of this matters if you are dehydrated. Your blood volume and circulation depend heavily on water. You need to be drinking at least 30 to 50 milliliters of water per kilogram of body weight every single day. So, if you weigh 70 kilograms, you should be aiming for a minimum of 2.5 liters of water daily. To make this easy, I recommend a pro-circulation shot or juice. You can blend watermelon, including the white rind, half a beet, lemon juice, cucumber, and a little honey and water. Drink this daily, perhaps 30 to 60 minutes before a workout or before dinner. This provides a natural surge of the exact nutrients your arteries need to expand and fill the penis with blood. Now, I know what some of you are thinking. Buying fresh beets and watermelons every single day, peeling them, and cleaning a juicer every morning is a lot of work. And frankly, it's hard to get the concentration high enough just from grocery store produce. If you want a faster, significantly more potent way to get these exact nitric oxide boosting nutrients without the mess, there is a specific 7-second daily habit you need to know about. It's a natural purple tonic that doesn't just boost blood flow, but targets the specific enzyme that is currently blocking your erections. I've linked a short video that explains exactly how this remedy works and how you can make it at home. Point your camera at the QR code on the screen right now, or just click the link I've pinned in the top comment below to watch that presentation. It is a total game changer if you want rock-hard results without the kitchen hustle. Once you've secured that fuel source. Finally, we arrive at step number 3, the software. We have to talk about stress management, anxiety, and sleep. This might sound like a cliche, but physiologically, it is the most critical piece of the puzzle. You cannot separate your head from your body. When you are stressed, whether it's work, traffic, or relationship issues, your body produces cortisol and, more importantly, adrenaline. Adrenaline is the fight or flight hormone. Its job is to survive immediate danger. To do that, adrenaline is a potent vasoconstrictor. It clamps your blood vessels shut to divert blood to your large muscles and heart. Do you see the problem? An erection requires relaxation and open blood vessels. Adrenaline forces them to close. You simply cannot have high levels of adrenaline and a strong erection at the same time. They are biologically opposed. This is often what causes performance anxiety. You worry about losing your erection, which causes fear. Fear releases adrenaline. The adrenaline kills the erection. And then the next time, you are even more worried, creating a vicious cycle. To break this, you must prioritize recovery. This starts with sleep. You need at least 7 hours of uninterrupted sleep per night. This is when your body produces testosterone and repairs vascular tissue. You need to adopt good sleep hygiene. Turn off screens, phones, computers, TVs at least 1 hour before bed. Keep your room dark, cool, and quiet. And right before intimacy, try to breathe. Deep, controlled breathing oxygenates the brain and lowers your heart rate, flipping your nervous system from a stressed state to a relaxed state. Also, take a look at your habits. If you are consuming a lot of pornography or masturbating with a death grip technique, you are desensitizing yourself to real physical touch. Taking a break from these habits can reset your dopamine levels and lower that anxiety of performance. If you feel like your anxiety is out of control, or you have deep-seated psychological blocks regarding sex, seeing a therapist or a sexologist can be a game changer. So, to recap, train the hardware with pelvic floor exercises and general fitness. Fuel the system with hydration and foods like watermelon and beets that boost nitric oxide. And protect the software by managing stress and prioritizing deep, restorative sleep. These aren't quick fixes that happen overnight. Give your body 3 months of consistent effort with these 3 steps. The biology works if you work with it.